What's up, YouTube? It's Rochelle Tannen. It's December 6, 2024. It's 6 p.m. here in Phoenix. I have not forgot about you guys. I told you in my last video I'm saving up for a new computer because this one doesn't do what I need it to do. And then I'm going full throttle in 2025. I'm still getting things situated here in Phoenix. I have not forgot about you guys. But I have to jump on to talk about the United Healthcare CEO Brian Thompson that just got unalived in New York, and they're saying it's a contract hit and all that stuff. I was watching a news story on CNN about this, and I had to jump on. In my 9 to 5, for the last almost 10 years, I've worked in healthcare. My forte is appeals and grievances, and for you all that don't know what that is an appeal or reconsideration is what you file it with your insurance company when they deny your claim. And not only can the patients do it, I used to file appeals on behalf of hospitals. I've done that for a few years. The position I have now, I do billing and deal with the major healthcare carriers, including UHC Optum Group. Now, while it's unfortunate what happened to Brian Thompson, I can't agree with CNN calling people's comments hate. You know, I get a lot of my comments pulled down on YouTube and get accused of being hateful and this and that and the third. Oh, no. The word hate, the words negative, and all that stuff has been misconstrued. No, CNN, what people are doing is letting out their anger, saying, listen, his life's no more important than their grandmothers or their newborns or their brothers and sisters and all the people UHC denies on a daily basis. And it's not just UHC. I can name some other healthcare companies because all of them do it. They deny for simple things. I remember I worked in Medicare a few years back, and shout out to the boomers as they were coming into their late 50s, early 60s a few years back. A lot of these healthcare companies wanted to stop covering dialysis treatment because it's very, very expensive. They don't want to cover almost anything. Then when something like this happens, they're wondering why people are crying out. Now, I stay in healthcare because I'm pretty good at foreshadowing things. And I said this back in like 2015. I'm going to stay in healthcare even with my degrees and things because my parents' generation, who is the biggest generation, they're getting older. And not only that, in my crazy little head, it's my way of helping people I don't know. Because when I interview for these jobs, I'm about to interview for some new positions actually very soon. I always tell them in my interview, I treat my patients like they're my grandparents. Because everyone wants their grandparents treated well. And the way they deny these elders, young people, babies, it's criminal. And then to add injury to insult, because if I have to carry insurance, I'm a Blue Cross Blue Shield kind of girl, and I advise you guys to be too, because they're one of the oldest, they have some of the best networks and coverages. Now, UHC, not only do they deny, what kills me is their premiums and deductibles. I mean, some of these deductibles, if you're a single person, don't get sick. And God, Lord, if you go out to start a family, $10,000 deductibles in a year, $12,000 deductible in a year, it's highway robbery. In addition to the $200, $300, $400, $500, $600 a month you're paying in a premium, it's criminal. I have a real big issue with CNN calling what people are saying about this event hate. Because I think I said this in past videos, but I'll definitely say it in this one. I'm tired of words being misconstrued and manipulated to fit what these corporate conglomerates want people to believe and feed into and talk about. It's not hateful. For all the hell they know, some of those people leaving comments across the internet, their grandmothers could have died because of UHC Optum Group. Matter of fact, Optum, which is another branch of UHC, I've contracted for Optum. I know how shitty they treat their patients. I know firsthand. And I'm going to piggyback off that. Not only do they mistreat their patients, they treat their workers like shit. They don't pay. They don't pay in the healthcare industry like they don't pay in any of these industries right now. The United Health Group, when I first got into appeals and grievances, that company that I temped for had got bought out by UHC. And they didn't want to pay their employees. Some of those people have been working there for years. One lady I can remember was working there for like 20, 30 years for the old company or some long-term time like that. And the way they laid her off, and it was around this time of year when they did it. I don't know why these corporations love laying Americans off around Christmas. And then when one of them get unalived, we're supposed to care. And let me just say about this unalive, I hate using that word. I wish we could just talk uncensored on YouTube like we used to. When these people get unalived, we're supposed to care. And I don't think that's fair. I know it's not fair. And you're looking at a person. I was a registered Republican. I'm for corporate. I'm for money. I'm for profit. But I'm not to the demise of greater society. And that's what we're going through right now. From every aspect. These corporations, they rob people. They steal from people. They outsource work. As I was saying, when I worked for Optum, a lot of those jobs, a lot of healthcare jobs that are by phone, online, and that type of thing, those jobs are outsourced too. This is one of the reasons doing the work I did in appeals and grievances, I would have to call the Philippines, India, the Caribbean a lot. And these are the people handling your healthcare, which to me, all healthcare for Americans should be handled by Americans. See, a lot of you guys don't see phone jobs, those that handle a lot of healthcare around the world. They have these people in these other countries handling your grandparents' insurance, and they don't give a fuck. They really don't. A good 90% of them. I kept my last position before I moved to Phoenix. I was there for a little over 3 years, and they used to give me the hard list because I would go hard at these offshore reps, as we call them. Because in my estimation, not only do these medical companies not cover like they should, you got to talk to someone across the world about a hospital that you went up the street. And a lot of young women and men should be manning those jobs here in the United States. Not India. Not the Philippines. And UHC, Optum, and their competitors, because they do it too, they outsource them jobs so they can exploit the people around the world, exploit Americans for their short-term profits. Now, I understand. Mr. Thompson was only 6 years older than me. He was only 50 years old. And I understand he's a cog in the system, but he was a part of the system. And when I say a cog, I'm not talking about the type of work I used to do, because it's pretty entry level. You know what I'm saying? But he's a cog in the system. And it's a disgusting system. Something as intimate as healthcare should always be in the States. All components of it. If you pick up your phone and call the health plan you're paying for, you should be able to speak to someone that's in the same country as you. And these are jobs and things I don't think a lot of, especially young millennials and Gen Z, because they're just starting their work careers, see that have been outsourced. We see the brick and mortar and how they completely destroy the infrastructure for that. But healthcare infrastructure, most of that shit isn't even in this country. And CNN has the unmitigated gall to say people are leaving hateful comments. Are you kidding me? Are you kidding me? As I said, I know for a fact that UHC is responsible for a lot of sickness in this country because they don't want to pay for shit. They don't want to pay for nothing. A lot of these healthcare companies don't want to pay for nothing, and they will fight you tooth and nail for things that they should cover. And I find that despicable. I find it absolutely despicable. While I'm watching this story, another thing that bothers me. This man was in New York for a conference. And the person who unalived him knew where he was, knew what time he was going to move. So somewhere along the lines, Mr. Thompson was doing some unsavory business. Because this guy did not just pick him out of the millions of people in New York and choose to unalive him. And then what's really crazy is that this guy's a professional some way. Because not only did he unalive him in almost broad daylight, he got away. The police don't know where the hell he is. Even with that picture of him, they don't know where he is. So that lets me know that that's a professional type of service, we'll just say. This wasn't random. So who knows who Mr. Thompson's wronged out there. And let me be clear again. While it's unfortunate that his life was taken, because it is, people's lives get taken every day on behalf of his company, the company he was the chief executive officer of. People let me be, because of censorship, people lose their lives every day over denials. So I can't say that it's hateful speech. It's just unempathetic speech. People in this society need to learn the difference. No, you don't have to be broken up when one of these CEOs, something happens to them. Like they don't care about your family or mine. You know, I enjoy working on behalf of older people and sick people, but older people particularly, because in my personal life, none of my family really gets old, my immediate family. So I revere the old, and I think most of them should be taken care of because they're fragile. And I also think, and let me say this before I close, young people's health should be taken care of. Yeah. Because they're crying over the workforce and the military. They can't get people because of their weight and this and that and the third. But our healthcare system's damn near in the toilet for young people. Young people should always be able to access doctors, dentists. Young ladies, once they hit a certain age, gynecologists, they should be able to access these things without breaking the bank. If you go into the hospital for a broken leg or you get sick, you shouldn't have to mortgage your home. That's despicable. And again, you guys have to remember, this is coming from someone who used to be a Republican. But I'm coming to understand some things have nothing to do with party, because none of these parties are representing the people. Neither one of them. Because if they were, the labor wouldn't be in the Philippines in our healthcare system. And these healthcare companies, UHC being the biggest, wouldn't be able to run amok. And there's no one regulating these people, or at least it feels like no one's regulating these people. And then when they do get regulated, it's regulated to their advantage. This is perverse. Now, again, it's unfortunate what happened in New York. I had to get that off my chest because I deal with insurance, and I'm going to be dealing with insurance in some capacity, more than likely anyway. See what happens here in Phoenix. But that just hit me in the chest. I don't like CNN anyway, because CNN hasn't been objective since the early 90s. But I had to get that off my chest, guys. I'll probably do a few more videos tonight, or this weekend, I should say. You guys, if you're going out this weekend, please be safe. Happy holidays. I'm Rochelle Tannen. I'm out of here.